Hi, everyone, and welcome. My name is Joe Corey, Healthcare Marketing Specialist with Minogue Medical, and I'll be moderating today's discussion about the evolution of evidence-based meal replacements and its role in enhancing overall nutrition. We'll also be talking about why Minogue Medical has chosen to rebrand its meal replacement solution from Slimtime to NuvoVi. This includes how this reflects in Minogue Medical's broader mission and what it means for healthcare professionals and their patients. I'm joined today by two incredible voices. We have Mr. Mark Minogue, representing Minogue Medical as the VP of Sales and pioneer of NuvoVi. Mark's here to share his vision, strategy, and purpose behind NuvoVi. Alongside Mark, we have Ms. Jennifer Brown. Jennifer is a registered dietitian, certified bariatric educator, consultant, and advocate for reshaping how weight, nutrition, and health are understood in healthcare and society. With over 18 years of experience in obesity care, bariatric solutions, and weight bias stigma, she applies a weight-inclusive, patient-centered approach to support health beyond weight. Together, we'll be exploring the state of meal replacement nutrition in Canada, the evidence behind meal replacements, and the opportunities for healthcare providers to incorporate it into their practices. Now, let's begin with a bit of background to understand a little bit more about Minogue Medical's decision to transition from Slimtime to NuvoVi. So, Mark, I'm curious, what would you say inspired the decision to transition from Slimtime to NuvoVi? And what does this new brand represent for Minogue Medical?
Thanks for asking, Joe. I'm very excited to be launching NuvoVi here in 2025, and really it's been an evolution of the brand. The brand Slimtime has really served its purpose, and it was an important chapter in our evolution as a company, coming from a strong background in bariatric surgery sales and a medical device company to really transform a new division of metabolic and bariatric nutrition. We wanted a brand that was really in line with our mission, and our mission is to create nutrition that is aligned with positive patient health outcomes, and really to steer far away from fad diets and dieting trends. Additionally, from a credibility standpoint, we wanted a brand that healthcare professionals can trust and that reflects that expertise that we have developed over almost 4 decades of serving the Canadian healthcare landscape.
Interesting. That's a good point as well about designing outcomes based on like a credible nutrition. I'm curious now, actually, what would you say sets NuvoVi apart from other nutrition products on the market?
Yeah, first and foremost, we really are trying, like I said, to move away from that stigma of fad diets, which are fast-lived, short-lived in most cases. We're really trying to position this as a medical solution, a medically based solution that is really only available through designated clinics and providers. It's actually supervised by healthcare professionals. Additionally, the evidence-based nature, we have a number of active studies that are ongoing in Canadian centers, at academic centers from coast to coast. We're going to be excited to share some of the results of those studies in the coming months and years. Additionally, we're focused on both the protein, the vitamin and mineral content, and even more of a focus on muscle, the maintenance of muscle, the benefits of not just weight loss, but also enhancing overall nutrition for patients.
Perfect. That actually was leaning into my follow-up question about differentiation and positioning. So that's perfect. Well said. Now, correct me if I'm wrong, but NuvoVi is currently only available through clinics, not retail. And I'm curious, why was this clinical positioning so important?
Yeah, so first of all, like I said, our background is in surgery, and we are really painting a medical canvas on this product. First of all, we want healthcare practitioner oversight. Patients deserve the right guidance. and that can really only be led by registered dietitians and clinicians to ensure the safe and effective use. Secondly, from a credibility standpoint, this gives additional credibility to the product as it is indeed evidence-based. Consistency, so we want a consistent experience for patients. And lastly, it really strengthens the trust between patients and their providers and us as the company.
Interesting. That last point got to me there. I'm curious. So between reinforcing that patient to provider trust, can you speak to, from a strategic business perspective, how does NuvoVi provide value to healthcare providers, surgeons, dietitians, and hospitals alike?
Yeah. So first and foremost, we want to be presenting a product that tastes great, that is made in Canada, that is backed by Canadian evidence, of course, with sites to eventually expand into other international markets. We're focused on providing educational tools and resources to help healthcare practitioners communicate the value effectively with their patients. We're focused on improving patient outcomes, both in the prehabilitation space for preoperative readiness, postoperative recovery, overall enhancing of nutrition. And for clarity, Joe, this doesn't just apply in the bariatric surgery space. This has broad applicability in orthopedics, gynecology, and a number of other areas that we're exploring.
Interesting. So it's been diversified to focus more on obesity care and management in general, more than just focusing strictly on the bariatric process.
That's exactly right.
Beautiful. Okay. Now, Jennifer, I'm curious from your perspective, would you mind speaking a little bit about the market differentiation as to the benefit to different healthcare providers, surgeons, and dietitians from a clinical point of view?
Yeah, sure, Joe. Thanks so much. I think Mark's done a really good job of kind of painting the picture of how the meal replacement space has really changed and diversified with a lot of the clinical evidence that we now have around meal replacements, kind of expanding beyond this just weight loss mentality, because we know that weight regulation is very difficult to manage just from one lens being nutrition. Most meal replacements often in the marketplace talk about calorie deficits and more of a dieting weight loss perspective, but we are forgetting the fact that when people lose weight, maintain weight, or gain weight, we're really focused on people's overall nutrition, their health, their quality of life, especially now with a lot more importance on muscle health. So I do believe that we're seeing a nice shift in this space, and that's where the meal replacement's focusing on not just for bariatric needs, but we can see this expanding to all other areas. So yeah, as a dietitian working in both clinical and research areas, I see the benefit of how this can be useful for quite a lot of people. Not every single person, but that's where we individualize care and we follow a lot of the guidance that's been published on clinical practice guidelines.
Beautiful. And you mentioned something that stuck with me, the focus on the impact of muscle health. I found that to be a common pain point with people transitioning with including meal replacements within their lifestyle. Can you speak a little bit more about how protein density and evidence-based formulations may play a major part in making sure that people are receiving the right meal replacement?
Yeah, sure. I mean, right now the space around muscle health is growing. We know the importance of not just muscle quantity, so like the amount of muscle that we have, but also the quality. And where more and more evidence is showing the importance of where not just nutrition, especially protein, but we're also seeing the importance of resistance exercise combined with medical nutrition therapy can help support people who are either at risk of losing muscle or perhaps people's muscle health may not be as, as high quality as it could be. So in today's day and age, I think it's a really important feature that clinicians need to pay a lot more attention to. And I think the future of what we're seeing in both evidence and practice is to start looking for signs of sarcopenic obesity or looking for malnutrition. And this is where, for some people, adding in or using meal replacements can be quite helpful, just to make sure that they are getting a high quality protein um, meal replacement in addition to their calories and all of their micronutrients.
All right. That sounds great, Jen. Thank you for that. Now, that leads me to my next line of thought. I'm curious about what are some common patient barriers that exist around meal replacements? And if possible, can you speak to how NuvoVi has been formulated to fill in those gaps?
Yeah, excellent. I mean, I think that's one of the big pieces, and I know that Mark touched on that as well. One of the biggest barriers I think we see in the space, both just in society as well as in clinical practice, is that patients often perceive meal replacements or any type of, liquid drink. They often perceive it as like a diet product. And, there's a lot of expectations around weight outcomes. And when people don't reach those expectations they had about, how much weight that they were hoping to lose, it can cause a lot of internalized weight bias and stigma, and people feel like they're failing, or they feel like it's something they did to themselves. So there's a concern from that angle in terms of where a lot of patients have some barriers around how meal replacements are perceived. One of the biggest pieces I often hear, especially for people who may be using meal replacements as partials or a full meal replacement, is often the taste, or the ability to be able, like, am I going to be able to use this product for, every day for the next few weeks? People often are concerned that they'll feel hungry, or um, just from a clinician standpoint, I'm always worried when people use something over the counter, because oftentimes they don't provide enough, calories or, micronutrients in order to be nutritionally balanced. So it is a concern that we tend to see with patients who are, considering or using meal replacements. Whereas with the NuvoVi product, and Mark talked about the importance of, this isn't something that you can just buy over the counter and do it independently, which is what I think most of the industry has done, is very much put it on the end user. Whereas this is part of a comprehensive, multidisciplinary type of team approach to support people who are looking to use a product, so a meal replacement in this case, but have it customized to their treatment needs, their goals, their values, their preferences. And so the big difference with NuvoVi is that it's not a dieting product, it's not a weight loss product. It's really around focusing on people's health, their nutrition, their overall function, quality of life. And because NuvoVi has higher protein, higher fiber content, it really helps to make sure, I know from a clinician standpoint, I do feel a lot more assured that they're getting the nutrition they need, rather than worrying about, some of the products that are available that are just protein and they don't have, enough calories, or they don't have enough micronutrients in them. The other piece that I find really helpful with the NuvoVi product is that it is a powdered product, which is very different than what's available on the market. Most products in retail are liquid based, and I often would hear people say it's, frustrating to have to carry bottles of liquid with them everywhere. Whereas powder, I mean, you can carry it in, your knapsack, your pocket, your bag, your purse. Like, it's a lot more discreet, and you can mix it a lot of different ways. So whether it's being used just as the meal replacement mixed with water, or in some cases, we might use it for people who need higher calorie needs when their nutrition or their oral intake is compromised. Well, it's been a really great opportunity to use the powder and then add in other high nutrient types of foods or liquids, like, different types of milk that have, a wide range of calories. Might add some, like, avocado if we need someone to get more fiber or more fat in their diet. We could add fruit to it. Like, there's a lot of different things we can do if we were using it not just as a total meal replacement.
Okay, interesting. You raise a good point there as well with the comparative difference with over-the-counter products. And knowing there is a bit of an oversaturation with products just available that boast their protein levels without really focusing much on the nutrition enhancement point of view. The question of trust comes in to make sure that people, how do they know how to trust that this product is what works for their patients? So I'm curious, why should healthcare professionals trust NuvoVi over the generic, over-the-counter alternative?
Yeah, another great question. I mean, everybody's going to be different. So, what is useful for one client or patient is going to be different for somebody else. But one of the key pieces that dietitians and health professionals looking at people's nutrition status is we really want to make sure that the product is approved by, Health Canada. It's been regulated through the, Food and Drug Regulations, that it matches the requirements for, their daily nutrient needs, and that it's already, it's been looked at, it's been regulated, and that's exactly why something like NuvoVi can be very helpful, because it has gone through that process. It is considered a meal replacement through the Food and Drug Regulations of Health Canada. And it's designed specifically to be used both, in a medical and a supervised medical nutrition therapy approach. So I think that's another piece that's helpful, because you can customize it. So as a dietitian, that's part of our job and our role, is to be able to customize people's nutrition requirements.
Now, you mentioned a little bit about the current state of meal replacement products in Canada and how closely they abide by Health Canada's regulations. And knowing how the guidelines and regulations change and adapt on a regular basis, can you speak a little bit about your perspective on the current state of meal replacements in Canada and where you see NuvoVi fitting in?
That's a really good question. I think part of the problem that we see right now in the current environment is that it's quite confusing for the public. What's the difference between a meal replacement and just a protein supplement? You just think about it every time you go to the grocery store, or you go to, a big department store, there's always, all kinds of different products on the market now. And I think for the average consumer, when you see things that are high in protein, you automatically assume that that's good for you. But people don't realize that meal replacements are actually made to be able to replace one or more meals per day. Not that we want to replace food, but for some time, like for some people, that can be a way of making sure that they're meeting their nutrition requirements in times where they might have, life events, or things might be compromising their overall nutrition health. So whether they're getting ready for surgery, or have had surgery, or even just in general life, I find that some people, especially if you've been living with chronic pain, or you have difficulties walking or standing for long periods of time, using a meal replacement can be quite helpful. But again, I see a lot of times people using products that are not considered meal replacements. They're more what we call like a nutrition supplement, and they don't really meet all of the nutrition requirements. And so that puts them even at higher risk for losing muscle, or losing strength and losing energy. And that just means that in a day, they're not going to be the best version of themselves. So I do feel like having something like NuvoVi, especially prescribed or recommended by a healthcare professional, is in the best interest of people who are looking for something that's going to work for their needs. And the fact that NuvoVi has, not just being Health Canada and having the requirements of being a meal replacement, it also provides a higher amount of protein, which we don't really see in a lot of the over-the-counter products. That not only does it meet the calorie requirements, but it also has, 22 grams of protein. It has 4 grams of fiber per serving. It's, low in carbohydrates, so it's considered, safe for people who are living with diabetes or insulin resistance. And so there's again another really great advantage, I think, of using this type of product. But as a dietitian, I'm always going to use that hat to say there is no one perfect solution. every single person is different and requires something unique for them. So that's where this product is just something else that clinicians can add to their kind of toolkit of options for their clients and patients.
Interesting. That raises a point too, like knowing that's how the current positioning is with how meal replacements are perceived and used. I'm curious about the emerging change over time. So let's look a little bit into the future of where meal replacement nutrition is going. Can you speak to any trends in clinical nutrition or bariatric medicine that healthcare professionals should be paying attention to be a little bit more proactive with reinforcing their patients as this industry changes and evolves?
Yeah, right now, I think we're seeing a really big shift in understanding muscle health and recognizing that not every single person, living in a larger body has the disease of obesity, and just the same as not everybody living in a smaller body is considered quote unquote healthy or doesn't have health conditions. And so we're noticing now that people of all sizes can be at high risk for malnutrition. They also can be at higher risk for sarcopenic obesity. So what is sarcopenic obesity? I don't want to say it's a growing trend because it's, in the medical field, it's been around for quite some time, but I think now we're seeing a lot more evidence and a lot more hype around the importance of screening for it. And there's more clinical guidance in terms of how to assess for sarcopenic obesity. So sarcopenic obesity is basically when someone has a low amount of muscle mass and a high amount of body fat. And so we can't actually tell if someone has sarcopenic obesity just by looking at them, which is why every clinician needs to do a very comprehensive exam or assessment. And we know that the prevalence of sarcopenic obesity can be as high as 1 in 4 people living in larger bodies. And for people who are experiencing or considering metabolic bariatric surgery, evidence tells us that people can be at high risk for vitamin and mineral deficiencies. So we see about 1 in 3 people prior to metabolic bariatric surgery being at risk for malnutrition. So I do believe that this is a big opportunity for clinicians to really start honing in on some of their skills and their training in doing physical assessments. In nutrition, we have something called a physical focused nutrition assessment. And this is something we can apply for not just malnutrition, but also looking at muscle health. The other piece that I think we're seeing a big trend, I guess, in is the role of how meal replacements and just overall nutrition can be very helpful in times where people's appetite might be compromised. So we think about right now, a lot of evidence has come out around the success and the cardiometabolic improvements that GLP-1 medications are having. But one of the side effects that we're concerned about is people are not getting enough nutrition. They're not eating enough. And that's not the purpose of these medications. So using a meal replacement is a way of, especially at times when people's, if they have nausea or if their appetite has been really low, this is a great opportunity for us to make sure we can get their nutrition in. It's in a liquid form. You can customize it again to their nutrition requirements. And even for people who might be trying to manage or even lose weight, they can still use meal replacements, especially a product like NuvoVi, because it's especially designed for that. So it's really nice to see this field kind of expanding beyond just this idea of just weight loss and really focusing on people's overall health, muscle health, function, and quality of life.
I was curious about the sarcopenic obesity, and that's a great point you raised there. I think that there's definitely a destigmatization that needs to be had with seeing what you see in the surface versus the potential malnourishment prevalence that's happening on the inside. And between the screening tools and its overall, thank you, great answer. Mark, hearing Jen speak about these points here, about these emerging trends that clinicians and healthcare professionals need to be aware of, Can you speak to how Minogue Medical plans to innovate in nutrition to address these evolving needs?
Yeah, absolutely. So we are going to start with the existing formula, which we actually updated a few years ago. We actually convened a pan-Canadian registered dietitian group and did an exercise in voice of customer where we went out to various registered dietitians, longtime customers, to give that feedback of what is best for customers. So that it has been an iterative process. We also do have a line of complementary products in our portfolio, which include solid foods, including bars, and a few other innovative options that will not be meal replacements, but rather meal supplements to help in this longer term journey for patients, because rest assured that this is a lifelong process for patients. And additionally, we will be introducing other products, both non-invasive and surgical technologies that will be complementary and symbiotic with the use of our nutritional line of products.
Interesting. So it sounds like we're taking a bit of a 360-degree approach to not just working on one solution, but surrounding it with the right support system between different options with complementary products to help reinforce the adjustment, and then surgical solutions and minimally or non-invasive solutions as well. And being a provider that exhibits these few products or services, really tying them together and making sure they can reinforce each other sounds impactful.
It's really a big part of our vision, Joe, as a company. In 2025 and beyond, in the next few years, customers can expect to see some novel and innovative technologies that we're very much focused and invested in. And, it really rounds out our portfolio and establishes us as a metabolic and bariatric solutions company. And we're very proud to be those consultants in the marketplace to, I guess, equip, elevate, and diversify the armamentarium that bariatric physicians, surgical physicians, non-bariatric, and of course, registered dietitians and other allied health to tackle obesity and the various other avenues that we've explored today.
Perfect. Thank you, Mark. Now, I'm curious, beyond what we've talked about today, are there any other gaps that NuvoVi is filling industry-wise?
Yeah, absolutely, Joe. Being in surgery every day as a company, as well as, in clinics and various centers, what we hope to achieve is now give that confidence to healthcare providers that they have a solution to present to their patients who are managing through obesity. They have now the tools, the products, and the support from us to be able to provide these options that may have otherwise not existed before, or at the very least, a broader base of solutions that can help them.
Interesting. I'm curious, Jen, does any of that resonate with you, with the current state of the evidence-backed nutrition that's currently on the market?
Yeah, actually, Mark brought up a really good point around how, the nutrition line of the Minogue products, because they have such a strong background in the surgical and medical space, the nutrition piece, I think, has been lacking in a lot of the medical industry in other areas besides like obesity care or bariatric care. And so you think about, there's, patients of all sizes and all health conditions, and I'll speak specifically to people living with the disease of obesity. They are often discriminated against and stigmatized because, they go in and they need to have like a hip replacement or a knee surgery. And, our medical system, unfortunately, has not equipped our healthcare providers or our system in place to support people with evidence-based requirements until now. And I think now that we have some of the top, global guidelines around obesity care, using a meal replacement in conjunction with other obesity treatments is a way to help support people who otherwise may have been declined surgeries, like other non-bariatric surgeries. And we're seeing more and more of this, like gynecology. We're seeing more studies coming out, and more more professionals are interested in how can we support people living with obesity, whether it's for fertility or people who may be undergoing like oncology treatments, different abdominal surgeries. There's a lot of space where I think products like this plays a huge role in people's ability to get access to care, get treatment, and overall, I mean, that's just going to help not just their quality of life and their overall health, but it's going to help our economy. It's going to help, the greater society at large too.
It sounds exciting. Now, with that in mind, I'm curious from a healthcare professional point of view. So what would you say would be your recommendation to healthcare professionals or bariatric professionals who are considering introducing a meal replacement like NuvoVi into their program?
Yeah, great questions, Joe. I think probably the biggest message I'd love for everybody to take away is rethinking how we frame meal replacements. So instead of thinking as, meal replacements as weight loss, let's shift that focus to enhancing nutrition status. And I think making sure that staff, especially, the front line to all the way to the clinicians, to management, making sure that everybody is using consistent, non-biased, and, patient-first language that focuses on improving people's, their strength, their recovery, their health, rather than dieting or deprivation or things you can't have. I really love that about NuvoVi and Minogue Medical, in terms of this isn't a shake, this isn't a diet, this is a clinical tool that can help improve outcomes. And whether it's cardiometabolic outcomes, quality of life, muscle health, energy, appetite, just overall body composition, whatever those values are to the client or patient, I think that's a really important piece that I want people to take away from this. And I do think that there's a role where even positioning the NuvoVi product as a bridge to another type of treatment, or to optimize or enhance someone's nutrition before another type of surgery. Those I think are the big pieces. So yeah, I'm really excited about the future. I'm really excited about how our healthcare providers can help change this shift, and making sure that there's products available that will, match the evidence that we see.
Well said, Jen. That's fantastic. That's very insightful, actually. Thank you for that. Now, along those same lines, Mark, I'm curious about your perspective. What would you say directly to healthcare professionals, healthcare providers alike, about why NuvoVi matters?
Yeah, NuvoVi matters in both the bariatric and non-bariatric space, both surgical and medical programs alike. It is a clinically effective, evidence-backed, and cost-effective way to enhance patient outcomes pre and post-surgery. We are going to continue to work towards mounting the proof and evidence to support that. And we're hoping that clinicians across Canada will embrace this in various clinical contexts to the benefit of their patients and their healthcare journey.
Amazing. Great points. Thank you. Without further ado, I'd like to say thank you both to Mark and to Jennifer for your insights, and thank you, the viewer, for watching this today. Whether you're a healthcare professional, dietitian, surgeon, clinical leader of all sorts, you've taken the time to be here, and for that, we appreciate you. If you are interested in learning more, we invite you to connect directly with Minogue Medical to access our healthcare provider resources and explore opportunities for training and potential partnerships. You can find all of our contact information in the description below. Thank you for joining, and we look forward to collaborating with you to bring your patients better outcomes.